I went to Caddo Magnet High School here in Shreveport, and from there went on to LSU Baton Rouge, majored in biochemistry, and then did my medical school here up at Shreveport, graduated in 2000, and completed a residency program in ENT in 2005. My specialty is otolaryngology, also known as ear, nose, and throat, and we treat pediatric patients, adult patients, any age really, and as it sounds like, ear problems, sinus and allergy problems, any disorders of the throat, voice, swallowing, neck, all those sorts of things. During medical school, you're exposed to all sorts of different specialties, and this particular one, just being around the residents at the time, they all seemed very happy, and that was a big, sign that this was for me. And there's a lot of things to, deal with. There's a lot going on between this area right here, so it never really gets boring. You never see the same thing twice, which is it's nice. And we do a little bit of surgery, quite a bit of clinic, and frequently patients don't need surgery, and that's always a good thing for them. I'd always like patients to feel, like I'm listening to them. And I had a patient early on in my career tell me, what would you do if it was your family? And at the time, I didn't answer immediately, but I've always, taken that to heart, and I try to guide patients in that direction and make suggestions and recommendations based on that. And there's some new things that we can offer that we didn't have when I finished training. People with sinonasal problems, polyps, the mainstay of that has always been surgery, which, of course I enjoy doing surgery, but there's some new immunotherapy that can be done so that people don't need to have surgery over and over again. There's some other in-office procedures which are available. The Clarifix, that's a procedure where we can actually try to end people with that chronic nasal drip, and I've had some real good success with that. There's a few other things that are new that we can do. Heart catheterizations have been around for a long time, and that involves a balloon dilation, and we're finding we can use that balloon in other places like the sinuses, the eustachian tubes to help with ear pressure. So there's some new things that we can do these days. Well, I'm actually a hearing aid patient myself. I'm not wearing it currently, but I do use it. Hearing loss, it's more than just an annoyance. A lot of people don't realize that. Hearing loss can lead to wanting to withdraw from conversations. It can lead to depression. It can even contribute to dementia. And I always try to let patients know that we're not trying to sell hearing aids. We're just trying to help people, and I think that's an important thing.